So when we talk about muscle strains, and if you've looked at some of my other videos, I talked about ligament sprains. And as I described in ligaments, the ligament itself, the length of the ligament, is created of separate fibers, kind of like a rope, that come together and create the whole ligament. And the muscle's the same way. It consists of a bunch of different muscle fibers all coming together to form a bundle in the length of that. So the function of a muscle is to contract or relax. It's what creates the movement to our body, to our locomotor system. So when we look at that function of creating movement, we need something to restrict that movement. And there's a delicate balance between the two that determines whether we injure a tissue or not. The muscle creates the movement, the ligaments restrict that movement. If you injure the ligaments, the muscle can contract and move that bone excessively, thereby creating damage to other tissues that are very important, like the discs and the nerves. Now when it comes to muscle, and particularly as it relates to the spine, there are various layers of muscle that all do the similar things, potentially. You have very small muscles, very deep, that cause the small motion between vertebrae that we see. And again, it moves it in all these different directions. Then you have larger muscles that may go one or two connections of vertebra that are superficial or outside of that, closer to the body. And you have longer muscles that may attach 5 or 6 different areas. Plus these muscles are also going from the spine down to, say, the pelvis and create the movement between the pelvis and the spine. So why that's important is because one area of the spine will eventually cause problems in other areas of the spine, or even other areas in the locomotor system, hips, legs, and so forth, because you have these not only small attachments, but you've got these larger attachments. So oftentimes I'll see somebody who comes in with back pain, and as the longer they have that back pain, the more the body starts to compensate and be affected by those problems there. So eventually it starts spreading up into the mid-back and even affecting their neck or creating hip pain. So typically the longer an injury lasts, the more effect it has, particularly locally, but also holistically or to the rest of the body. This white section here, that's called fascial tissue. And there's some muscles that have fascial tissue, and it creates kind of a wide connection to an area. And that fascial tissue is fairly strong, more like ligament, cartilage more than anything. It's very, very stiff. But you can see the effect of this muscle here and how it has all these fascial attachments going all the way up. So when there's a problem with the muscle here, it's not only going to affect the direct fascial tissue to the spine running down the center, but it'll affect all of this because it's all attached.